Hey doc, I know your office is out of network, but how does it work if I need surgery? This is a common question that patients ask. So here's how it works in my office. If you need surgery, we make sure that we do the procedure at an in-network facility so that the hospital or surgical center can bill your insurance. And so whether you see me or somebody in your network, those costs are going to be the same because again, the facility is in network. So this means the cost of your surgery, anesthesia, any procedures you get while you're in the hospital, your hospital stay, etc., will all be in network. The only thing that is out of network is the surgeon's fee. So I will not be billing your insurance for the surgery because I have no relationship with the insurance companies. And so the patient pays me directly and I tell you exactly what the cost is for the surgery. And then my office will actually submit this claim for you on your behalf as a courtesy. And so whatever out of network benefits you have, the insurance will reimburse you for that surgeon's fee. So some patients get the entire fee back, others get 50% or more. So it actually works out really well. Hopefully that answers your question about how surgery works in our office. Let me know below if you have any other questions.